Hello everyone, my name's Sarah Cartwriter. I currently work as a pelvic floor physical therapist assistant, and I specialize in the treatment of pelvic floor dysfunction. An important topic to discuss with treating pelvic floor is the difference between sex and gender. So sex is the biological makeup of a person, and that is determined by the sex chromosomes that are inherited from our parents. This is a label that is defined at birth, and then gender is a little bit more difficult to define, but it is typically thought of as socially created roles and is divided between females and males for the most part, and how society expects you to act or think more so than your physical body parts. Gender identity, however, is more about how a person feels or expresses themselves and not about what is expected of them. So this gender-bred person is the perfect breakdown of the important aspects that make up a person. So you have gender identity, or how you think of yourself, gender expression, or how you demonstrate your gender, biological sex, which is determined by your sex chromosomes that are given to you at birth, and sexual orientation, or who you're attracted to in comparison to your own identity. So working specifically with patients that have pelvic floor dysfunction, it's important to be aware of biological and behavioral differences between male and female, as well as being aware of how the patient identifies. So if you're working with a patient with pelvic pain, you obviously need to know which muscles you're specifically working on, which are similar between male and female biologically, but accessing these specific muscles can look different between the two. Being aware of gender identity is also important, as this may be different than what society a lot of times considers the normal. There are times you may be treating a biologically male patient with male parts, but this patient may identify as female or vice versa. And this will change how you refer to their parts during treatment, and it's important to discuss this with the patient to allow them to communicate with you their identity and how they would like to be referred as. Treating pelvic floor causes a feeling of vulnerability and can be very uncomfortable for a patient initially. The main goal from the first day of treatment is to provide the patient with a safe atmosphere where they feel comfortable being themselves and allowing for open communication between the patient and therapist. And this can have a huge effect on the treatment outcome. If a therapist is not openly communicating or creating a safe space for the patients, this can cause the patient to shut down, and this can decrease the effectiveness of the treatment. It can create, increased muscle tension, reluctance to trying different treatment options, and it can even cause the patient to not return to therapy as they may not feel comfortable in that atmosphere. Open communication is so important in this. There are many different continuing education courses and resources that are available to educate therapists on creating more of an awareness with gender identity and treating patients based on their identity. The most important thing that you can do is just communicate and listen to your patient and their needs, and you can do this by giving them options and adjusting your treatments based on their comfort level. A huge part of creating the open communication with the patient is providing them with the information on what they can expect from you as a therapist, and let them know that you're there for them and that they're not alone, and you'll do everything that you can as a therapist to support them. And also having a list of healthcare workers and different roles to refer out to is super helpful. We may not always have the answers, but having these resources that we can provide our patients with that can help to show them that you're there to help them through their recovery process, whatever that may mean for each individual patient. One of the resources that I've found to be the most helpful is intimaterose.com. And this is a website designed with endless information and products that can help in the treatment of pelvic floor dysfunction. A couple of different examples of the resources is they have a page that goes over transgender care and the role of physical therapy, and so many explanations of the products that they provide and how to use them. Another awesome resource is Herman and Wallace, which I've actually taken a couple courses through. They offer continuing education courses that are geared specifically towards pelvic floor therapy, and they have a set of courses that focus specifically on gender diversity, and they discuss also the role of physical therapy in that as well. And they also have a course that introduces the topic of female and male pelvic pain, as well as many other courses. So if you would like more information on the treatment of pelvic floor dysfunction, you can contact me at scottryder@dryerpt.com.